Hi friends, welcome all of you to the class of gingival inflammation or gingivitis. I hope you all are doing good. Before proceeding, please make sure to subscribe this channel and turn on the bell icon for upcoming videos. And you can always support my work with your likes, comments and shares. So let's begin. So what is gingivitis? We need to understand first that what is gingivitis. You know the term itis means inflammation. So gingivitis means it is the inflammation of the gingiva or gums. Then we need to discuss what is the main causative factor for gingivitis. The primary etiology of gingivitis is the dental plaque, which comprises predominantly of bacterial communities. And this gingivitis could also be caused by systemic diseases, allergies, hormones, medications, viruses, and many other factors. This gingival inflammation are broadly classified into four stages. First one is the initial lesion, then the early lesion, then established lesion, and finally the advanced lesion. First, we will see what is the initial lesion. This is the stage 1, which occurs after the 2 to 4 days of the plaque accumulation. This is the subclinical stage, so that the cardinal signs of the inflammation cannot be visible in this stage. So clinically we cannot see any symptoms. We can see sometimes exudate or GCF. So what are the features that can be seen in the initial stages? Mainly we can see the vasodilation and exudate and GCF, then migration of neutrophils. I will explain you in detail how these all processes are happening. First one is the vasodilation. So when I already told you that the dental plaque is the major causative factor for the gingival inflammation. So what will happen is that these bacteria and toxins, after entering into the connective tissue, they stimulate or activate the cells like mast cells or neutrophil to produce certain vasoactive mediator. So these vasoactive mediator, they causes the vasodilation, and they also cause the increased vascular permeability that leads to the escape of plasma fluids containing proteins called exudate. So from the blood vessels, what will happen is that this vasoactive mediator, they increase the permeability of the blood vessels, so that these plasma fluids containing proteins, that is known as the exudate, that can escape out from the blood vessels. So that is known as the exudate, and these exudate escape via the sulcus is known as the gingival crevicular fluid. Then we can see the migration of neutrophils. So there is a margination or adherence of leukocyte in the capillary vessel that can lead to diapedesis or escape of leukocytes, primarily the neutrophils, via the process called as chemotaxis, and they migrate to the area of insult and accumulate in the connective tissue, especially below the junctional epithelium. And this neutrophil also penetrates the epithelium. So these all features can be seen in the initial stages. So clinically we cannot see any symptoms. May exudate, we can see some exudate or gingival crevicular fluid. So this is the initial stage. Then next we will proceed to the early lesion or stage 2. Sorry. And this stage we can see usually after 4 to 7 days of the plaque accumulation. So in this stage we can see again the 3 different aspects we will see. First one is the proliferation of the blood vessels. In this stage, proliferation of the blood vessels was not there, only the vasodilation and vascular permeability. But when we reach this stage, we can see the proliferation of the blood vessels, then the collagen destruction. Here connective tissue, there may be lot of collagen are there. So about 70% of the collagen will be destroyed in this stage, and the surface area will be there will be the increase in the surface area, so that more neutrophils can migrate from the this area to outside. So this is the stage. So I will discuss you in detail. First one is the proliferation of blood vessel. So persisting inflammation can lead to the further recruitment of leukocytes like lymphocytes, monocytes, macrophages, plasma cells, mast cells. They all may recruit into the surface. Here neutrophil was the initial response. Neutrophil, the blood vessel neutrophil cells was the initial response, but here the lymphocytes play an important role. About 75% in chronic inflammatory, these lymphocytes are the chronic inflammatory cells. So what will happen is that these lymphocytes and macrophages, they produce certain growth factor, and that can lead to the angiotensin and proliferation of the capillaries. So there will be the increased number of capillaries. So this is the major cause of erythematous change that gives the reddish hue. Then we can see the collagen destruction. So after accumulation of the inflammatory cells in the connective tissue, the cells in an attempt to destroy the invading bacteria also cause damage to the surrounding tissues. So after ingestion of bacteria, leukocytes produce numerous enzymes and free radicals to degrade this bacterial agents. So these cells also released extracellularly and damage to the collagen. About 70% of the collagen and the gingival fibers and the dentogingival group got destroyed. Then we can see the inflammation may also triggers proliferation of the junctional epithelium, which starts the development of rete ridges between the epithelium and connective tissue. These rete ridges increase the surface area that is really important for the migration of neutrophils. So neutrophil from blood vessels, they move through the chemotactic gradient. So because of increased surface area, it will move to the epithelium, and the whole process of phagocytosis of microorganism will begin at this stage. So this is all about the early lesion or stage 2. Next we will see, so clinically what will happen is that here we can see clinically slightly edematous gingiva, and the bleeding on probing also can be seen. Then next is the established lesion. So that is the stage 3. In this stage we can see again a few changes like the ulceration. So both the junctional epithelium and the circular epithelium will show ulceration. So what will happen is that break down the continuity in the epithelium and ulcer formation that lead to the exposure of connective tissue. So connective tissue opens up into the oral cavity. Then what will happen is that the blood stasis, that is the another feature. The persistent inflammation causes continuous leak of plasma proteins or exudate from vessels, which increases the viscosity of blood. That is the sluggish blood flow, which is termed as the blood stasis, which results in anoxemia, localized area of anoxemia, because there is a shortage of oxygen. This can lead to the bluish hue to the gingiva. Then another change is that about the plasma cells. Amount of neutrophils seen in the initial and early stage are now slowly replaced by the plasma cells. These plasma cells, they produce antibodies. So we can see lot of quantity of IgG and Ig3, and these types of antibodies can be seen within the connective tissue. Then another feature is the erythema. So this RBC escaped from the connective tissue, and the hemoglobin is broken down into pigment, which may further redden already erythematous gingiva. So at this stage, clinically, lot of erythema associated with bluish hue. I told you now how the bluish hue is happening in the gingiva, mainly because of the anoxemia, and a lot of erythematous gingiva can be seen. And next is the advanced stage, that is the stage 4. In this we can see some changes in the epithelium, connective tissue and the cells. In the epithelium shows ulceration which can expose connective tissues in certain areas, and junctional epithelium shows apical migration. So the cells in the coronal aspect between the tooth and the epithelium, that is the DAT cells. About this DAT cells I discussed before when I discussed about the junctional epithelium. So these cells, what will happen is that the hemidesmosomal attachment is broken down and slowly the junctional epithelium migrate apically. Then in the connective tissue, all the features like vascular proliferation, vasodilation, vascular permeability, blood stasis impaired, venous return, these all can be seen. Along with that, inside the connective tissue, lot of bacteria that gets access through the ulceration. I discussed now just now about the ulceration. So through the ulceration in the epithelium, these bacteria and the byproducts can access into the connective tissue, and these byproducts can attack the alveolar bone also, leading to the destruction of alveolar bone, that is the destruction of the periodontal apparatus. So these all are the stages, different stages of the gingival inflammation. I know you all are clear about this topic. If you want to discuss some of the questions related to this topic, means you can comment me in the comment section. Then in the next episode I will come with another topic. Thank you.